We focused a lot of episodes on the coronavirus pandemic and the federal response to it. Depending on the results of the upcoming election, that response could look a little different next year. So if Joe Biden were to be successful in his presidential bid, what might we expect from his administration in terms of pandemic-related policy? That's the topic of this week's Healthcare Triage. Joe Biden and Kamala Harris have laid out a 7-point plan to beat COVID-19 should the American people vote them into office. Point 1 focuses on testing and tracing. Its aims include increasing testing magnitude by doubling drive-through testing sites, investing in things like at-home and instant tests, setting up a pandemic testing board to enable production and distribution of massive amounts of tests, and establishment of a public health job corps that will enable individuals and local organizations to perform contact tracing in at-risk communities in a culturally sensitive manner. Beyond expanding physical access to tests, this aim also pledges to remove financial barriers by ensuring everyone has access to free testing. Point 2 focuses on personal protective equipment. Its aims include continued use of the Defense Production Act to ensure sufficient supply of needed equipment, such as face masks and shields, and ensuring long-term U.S. production capabilities to avoid future shortages and/or dependence on other countries should another similar crisis arise. Point 3 focuses on guidance and other resources. This point aims for clear guidance from the CDC on which measures to take based on an area's viral spread. This includes guidance on social distancing, stay-at-home measures, and best practices for businesses and schools upon reopening. This point also proposes funds to help states, schools, and small businesses struggling from shutdowns and/or struggling with the cost of reopening safely. Point 4 focuses on treatment and vaccine distribution. Its aims include investment in a manufacturing and distribution plan that avoids providing the vaccine first to wealthy and well-connected people, and addressing vaccine safety and efficacy, pledging to put scientists in charge and to make all data publicly available for any FDA-approved vaccine. Point 5 focuses on high-risk Americans. Its aims include the establishment of a racial and ethnic disparities task force, a nationwide pandemic dashboard so that anyone can check current levels of transmission in their area in order to better gauge risk as they make daily decisions, and includes a specific plan for supporting older Americans and Americans with disabilities. We'll link to those plans down in the description. This aim also includes a plan to ensure health coverage during the pandemic. We'll link to that in the description as well. Point 6 focuses on mitigating the threat of global pandemics. Its aims include restoration of the Directorate of Global Health Security and Biodefense and renewal of the U.S. Agency for International Development's Pathogen Tracking Program. Both of these were created to assist in preparing for disease outbreak, but were either eliminated or allowed to expire in recent years. It also aims to restore the U.S. relationship with the World Health Organization, admitting that the organization is not perfect, but is necessary to the global pandemic response. It also aims to expand the deployment of CDC disease detectives, which provide us eyes and ears on the ground. And lastly, point 7 covers the implementation of a nationwide mask mandate. Some other proposals within these aims include elimination of patient cost barriers to COVID-related preventive care and treatment, emergency paid sick leave and caregiving leave, assistance for those in less formal employer-employee relationships like independent contractors and gig workers, ensuring that COVID-related communication and decisions come from scientists and public health professionals rather than politicians, ensuring reach to resource-poor areas and support for telemedicine, expanded food relief, continued student loan and mortgage relief, and continued small business support. We can't cover all the details in one video, so this is just a broad sweep of the major points. As mentioned, we'll include links to specific plans in the video description. The Biden team has acknowledged that beating back the pandemic will not be an easy job, no matter who wins the election. Here at Healthcare Triage, as always, we are focused on data-backed healthcare policy. Regardless of who occupies the Oval Office next year, we will continue to cover COVID and COVID-related policies with a hard light on the scientific evidence. Hey, if you enjoyed this episode, you might enjoy this previous episode on T cells and COVID immunity. We'd also like it if you'd like and subscribe down below, and head on over to patreon.com/healthcaretriage, where you can help support the show, even in a global pandemic. We'd like to especially thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral Sam.